categorically needy Medicaid, it's still talking about the same thing. As I said, the income guideline is very low. It's the 75% of the federal poverty level, which is $943 for a single person in order to qualify for a medical program. We also offer other programs that'll help pay for the Medicare premium, and that's very helpful. The Medicare premium went up to $174.70, so that's a big chunk of money that's coming out of individual Social Security checks every month. So those income guidelines are higher. Resource limits are also higher for those programs, so that's something we potentially could help them with. Other Medicaid programs we have are nursing home Medicaid, waiver Medicaid, which is similar to nursing home. Individuals that probably should be in a nursing home but wish to remain at home, we can help with nurses' aides, nurses. They will come into the home and help support them. There's also the Breast and Cervical Cancer Project. So individuals that are not eligible for our normal Medicaid programs through the Ohio Department of Health, they could receive assistance if they have been diagnosed with breast or cervical cancer. And then we also have a program for individuals that are working that are disabled. So maybe they're receiving more than that $943 a month in income. We could help with a program where they may have to pay a premium every month, but then they would qualify for a Medicaid program. The last program is the one that most of our families would qualify for. This is a Medicaid program called MAGI, Modified Adjusted Gross Medicaid, and it's based on tax filing status. So anytime a child is 19 or under 19 and living with a parent, they will always be part of the parent's household. Children under the age of 18 could be eligible with income up to the 206% of poverty. So that's a pretty high limit that we can allow. Adults 19 to 64, up to the 133%. And then parents or caretaker adults, they could receive it up to the 90%. If an individual is under the age of 18, they are not permitted to apply for Medicaid benefits without a parent or legal guardian unless they are considered emancipated. So this is, if you've seen my presentations before, this is something that we've kind of added in here. So basically, the age of majority in Ohio is 18. So they are requiring us to get a statement from the individual applying, indicating that they are living apart from their parents and providing their own self-support. So pretty much we can indicate, we can say that someone is emancipated based on that statement that they would need to provide to us. I know that I've received some email communications that some other counties were providing kickback that these individuals can't apply, but they truly can apply. We just need that added statement indicating that they don't live with their parents and they provide their own support. I think that an additional letter, maybe from the individuals that they work with in the school that is more familiar with their situation, maybe providing a statement indicating, we know that this person is not living with their parents, they're living, with a friend or something like that. That would just be an added bonus to for us to indicate that they are emancipated and that they could qualify for benefits on their own. The next thing is just a list of non-citizenship qualifiers for Medicaid. I'm not going to read through all of these, but if you have an individual that is not a citizen, please don't hesitate to still submit an application for them. There's a lot of different things that we can do, a lot of different categories that we can get people qualified for Medicaid. Some of the verifications for our immigration to establish immigration or an alien status is their lawful permanent resident card, employment authorization card, a foreign passport with an I-55 stamp, or an I-94 record. And that's what they would receive when they came into the country. Other documents received at the time of the individual's arrival may be sufficient. We have a system that we can go through the Department of Homeland Security, and we can check on their status also in case they don't have any verifications. But again, please do not, if they're not a citizen, don't tell them that they're not eligible. Still submit that application, and there's lots of things that we can do. The next thing is our child care program. As we all know, child care is extremely expensive. So we have a program that will help pay for child care. So up to the age of 13, or if an individual has special needs, we may be able to pay it for a longer period of time. They can choose a state agency or they can choose to go to a center, or it could be a county approved home. So we will help pay for either of those situations. There's weekly co-payments based on their income. The parents or the caretakers need to have a qualifying activity in order for us to pay for that. So they have to have paid employment, training, or education, or they are participating with our How Works First or our food assistance program. There's also protective childcare, and this is for individuals that are in protection through Children's Services. There's a plan through Children's Services. So we can help pay for their care while they are completing the requirements of their plan in order to either get their children back or just to maintain a safe environment for them. The income guidelines for the child care program for initial eligibility is 145%, and then ongoing eligibility could be up to the 300%. So as long as an individual can qualify initially, they can make pretty good money and still qualify for us to help pay for their child care. And how to apply for benefits. Many of you know that our phone systems are kind of a nightmare sometimes. We've actually recently made some changes to that. So individuals can call the 1-844 number that is listed, and they can apply for benefits over the phone with an eligibility worker. We have adjusted those times. So they're Monday, Tuesday, Thursday, and Friday from 8 a.m. to 1 p.m. And then on Wednesdays, only until noon. The phone waits were approaching 3 hours. Individuals would have to wait on the phone. Happy to report, since we've implemented some changes, that it's less than an hour. Oftentimes, you're going to get a worker as soon as you call in. Again, the best times to call are at 8 o'clock in the morning. It's when everybody is ready, waiting for those phones to start ringing. It's when you're going to get the quickest attention. You can also apply online. So the benefits.ohio.gov, you can submit an application that way. For our TANF and our food assistance program, we have to actually talk to the applicant. So we have to complete an interactive interview, gather some information. But for our Medicaid program, we actually could do that through just through mail. Oftentimes, we're able to electronically verify income. We may never speak to a Medicaid application, or an applicant, I'm sorry. So if they submit an application online, it will be assigned out and it will get processed. We have 30 days to process all applications. So, we stick with that. That is definitely a state guideline that we stick to. We also have more information on our own website, thestarkjfs.org, and you can find different fact sheets. There's also applications that you can print online on our website. Our lobby is open Monday through Friday, 8 a.m. to 4 p.m. And individuals that have applied that want to submit verifications to us, there's an email box at the bottom that they can submit those to. Virtually, someone doesn't ever have to walk foot into our building. It could all be done via phone, via the internet, emails. There's always been such a stigma about coming to our building and applying for benefits. And so we've tried to make it a lot easier so individuals do not have to do that. That was a lot of information very quickly, but does anyone have any questions for me?
So I do see a question in the chat so they don't have to be emancipated by the court. I think that's always the big question of when you've got someone under the age of 18. And if you could just clarify that.
They do not. As long as we can verify that they're living apart from the parents and providing their own self-support, then we can use that in order to take that application for Medicaid. And as I said, getting backup information from other individuals that know them can kind of support the information would always be beneficial.
Are there any other questions? I myself was wondering, so you talked about how minors who are not in the company who are not in the custody of their parents can apply using that letter. What about for cash or food assistance? Does that look similar? Or I know in another meeting you mentioned like making sure that they explain that they are not a dependent as far as taxes. What is that process?
Right. The dependent for tax purposes is for the Medicaid program. So if an individual is being claimed by their parent, so maybe they're still not living with them, but they know that their parents are going to be claiming them on their taxes, unfortunately, that parent's income would need to count. If they don't know what the status is, they don't need to go chase that information down from a parent. We don't want to put someone in a situation where, you know, they're not speaking to their parent and then we ask them to go get information from them. We would never do that. But as far as food assistance, and that's just for the Medicaid, the tax filing. For food assistance, yes, as long as they are not under the parental control of someone, they can receive benefits on their own. So again, if they're just living with a friend, you know, kind of couch surfing, they could receive benefits on their own if they are required to supply themselves with support. Now, as far as the cash assistance, they would not be eligible for cash assistance. They would have to be with a parent in order to receive cash, unless they were pregnant.
Okay. And that's until age 18?
Correct.
There's another question in the chat. Is there any assistance for emergency housing? Any help paying initial deposit or first month's rent? And do you know if families can access this type of help through Finn's cases with Children's Services?
We do not, in the Human Services Division where I am, have any assistance to help with the rent or, you know, emergency housing. There is the Finn's program through Children's Services that they can call them directly. I know that they do not have to have a case with Children's Services to potentially receive help through the Finn's. So they would have to reach out directly to Children's Services for that.
Another question I had, you talked a lot about how students who may be undocumented or be unsure of their citizenship status, there might be hesitancy to apply. And you guys are not a reporting agency, that's correct? So.
Correct. We will not. They've actually, in a recent Medicaid training that I was in, they made that very clear that we are not supposed to be reporting anyone that comes to us as an undocumented citizen, that we are just here to help them. You know, unfortunately, a lot of the undocumented ones we can't help, but we are not reporting that to anyone. So they can feel safe coming to us.
And that would be true regardless of it. We have some districts who are outside of Stark County, but that is
statewide.
Okay.
Yes.
And there is another question in the chat. If a child is getting child-only benefits because parents have Social Security, if the child moves out, can the child continue to get those benefits?
The only way that they could is if they are in an approved living situation. They would have to be with, again, a custodian, a legal guardian, or a blood relative in order for them to continue to receive it. The child themselves cannot receive cash assistance.
Any other questions?
My email is on the front of the presentation, and please don't hesitate to reach out to me if you have families that aren't getting the assistance that you feel that they need, or they're not getting responses from us. Please reach out to me. As I've said before, I can't talk directly to you maybe about a case, but I can reach out to the family and we can make sure that their benefits are approved or, you know, get verifications that we need. So please feel free to do that.
That's great, thank you. And her presentation will be linked in that agenda for you to reference in the future. And thank you so much for that information, Jennifer. We really appreciate it. Next up on our agenda is going to be Christina May, and Ashley Hauser from Ohio Department of Education and Workforce. And we really appreciate you both being here today. I'm going to stop sharing my screen so you all can share yours.
All right. It was waiting. There we go. I see it. I assume everyone else can see it. If not, feel free to yell at me that you can't see it. But welcome, everyone. As Christina said, we are from the Ohio Department of Education and Workforce. My name is Ashley Heiser. I'm a grants management coordinator, specifically for funds that support students experiencing homelessness. And I will let Christina introduce herself.
Good morning, everyone. My name is Christina May, and I'm a registered nurse with the Office of Whole Child Supports at the Department of Education and Workforce. I am the school-based health coordinator for the department. I can get my screen to work appropriately here today. So we all know that when a student comes to school tired because they didn't have a safe place to sleep for the night, hungry because the last meal they had was the day before at school, in pain or ill because of unmet physical health care needs due to lack of insurance or lack of access to medical provider, depression or suicide, their ability to focus and learn is impaired. So through a system of whole child supports, districts and schools and community partners can help families deal with many of the physical health, mental health, and socioeconomic barriers that can affect a child's education. So the link between health and education is very strong. While education creates opportunities for better health with things such as better income, healthy behaviors, social and psychological benefits, and healthier neighborhoods, poor health can also put a child's education at risk with things such as chronic absenteeism, concentration, and learning disabilities. There are many conditions throughout an individual's life, from birth through death, that can affect their education and health, like social policies and individual family characteristics. So today, we're mainly going to focus today on going over some of those services that can be covered through the Student Wellness and Success Funds that are available from the State Department of Education. There are currently 8 allowable uses for the use of student wellness and success funds. These funds started back in fiscal year 20 when Governor DeWine and the legislature put this student wellness and success funds into place in the budget, and has continued since then. Over the bienniums, the covered services have changed just a little bit. However, these 8 services have been 8 that have remained consistent and are now the 8 that are covered with our current grant cycle or funding cycle that is working. So we have, of course, homeless youth services is one of those things that can be covered. Mental health services, physical health care services, culturally appropriate prevention services. This includes things such as some of the prevention education initiatives that schools do, child welfare involved youth services, community liaisons and programming, as well as family engagement activities, and then some before and after school programming.
And I saw later on in the agenda that Stark County ESC is going to talk a little bit more about the data. And so I am going to mostly speed through this section because y'all already have that covered. But just to ground us in Stark County, and I understand that Christina said that not everyone here operates or has a district in Stark County, maybe they're neighboring. But as a point of reference, from 2018-2019 school year up until 22-23, Stark County served an average of 708 students experiencing homelessness each school year, which is about enough to fill 15 buses across the county. Pre-pandemic, there was 766, an average of students experiencing homelessness. Post-pandemic, there was 621. A few factors that could be impacting a decrease of around 140 students could include that there is an increase in students living doubled up. So a student who lacks fixed, regular, and adequate nighttime residence, the definition of homelessness, that is sharing the housing of someone else due to hardship, that has increased. Those students were already really difficult to identify before the pandemic, and with the shift to online learning, with other, things coming up, that has been still really difficult group to identify. We've also seen across the state and across the nation, there has been a decrease in students residing in shelters and an increase in students who are living in hotel motels. The impact of that is that there, in theory, was like a central hub in order to identify students and provide supports and services. And now it's more dispersed throughout the county, throughout other districts. And so those are also just some challenges to be aware of. In case you are thinking about where to offer professional development or where to house some of the resources we're talking about, the highest proportion of students identified as homeless in Stark County specifically are in their senior year, 10th grade, and 5th grade. And 52% of students in Stark County are economically disadvantaged. The reason why I want to bring up this graphic is this graphic shows the entire state of Ohio, disaggregated by county and then school district, and it shows the prevalence of severely cost burdened households. And what that means is a household that is spending 50% or more of its monthly income on rent and utilities. In the housing policy space, there's often a saying that a lot of times households are one flat tire away from being evicted. So one flat tire, one emergency, that takes away from part of that 50% of their monthly income, and then there could be eviction. So as Christina said, homeless services for youth are one of the 8 allowable uses of student wellness and success funds. These are all included on the website, but it can include providing access to essentials like clothing and hygiene products. Homeless education liaisons have told me that specifically hygiene products have been really beneficial for students experiencing homelessness, shampoo, deodorant. It helps to, as Christina was saying, increase attendance, increase class engagement, increase confidence, help to build interpersonal skills with their peers and students. So those have been really beneficial. Transportation to and from medical appointments is also an allowable use. Title I Part A homeless set aside does allow for transportation to and from school and school-related activities like clubs. But when I was talking with homeless education liaisons, a lot of times they said, that's great, but we want our students healthy. We want them to not have to worry about any medical issues while they're attending class. Can we get them to and from their medical appointments, especially if they lack access to public transportation? And so student wellness and success funds can help to make up for that need. Also, systems improvements and infrastructure to identify, track, and support students experiencing homelessness. This could look like paying a stipend to a staff member to try to enroll a student online. There could be an address validation error that if a family is trying to enroll their student and leaves that section blank, it may not allow them to continue, which could be a barrier. Other districts have reported that what they do is if a family calls the transportation line and asks for a change of address, then the homeless education liaison reaches out to them to see if they could be experiencing homelessness. Same thing with cafeteria directors. If 2 families submit an application for the National School Lunch Program, they are able to then have the homeless education liaison reach out to see if it could be a doubled up situation. Also, collaboration with community partners to provide temporary housing solutions. You all are going to know your families best. You are going to know the community partners that they access. And so collaborate with those community partners to support families. Also, salary and stipend for a homeless education liaison or housing navigator. As Jen was saying, there are supports available for families experiencing homelessness and students experiencing homelessness, but it can be a complex system. So a systems navigator can help walk families through that. And the homeless education liaison, as you all know, have such passion for this job. The McKinney-Vento Act says that there are 10 responsibilities for homeless education liaisons, and yet this is an unfunded mandate, and oftentimes homeless education liaisons are trying to do the work, are actively doing it, but there are capacity concerns. And so student wellness and success funds can cover a salary or a stipend for this dedicated work to alleviate some of those administrative burdens. I'm going to turn it back over to Christina now, who knows a lot more about other allowable uses, but I will jump in with facts and data to contextualize how offering supports and services to all students can also exceptionally benefit students experiencing homelessness.
And if I could, there's a question, there were a couple questions in the chat, and Christina or Ashley, you might be able to speak with this, but I do know that not everybody in the district is aware of those funds. Yeah. And the reality that those funds can be used for so many different purposes that districts make decisions and prioritize. So they may not be using it for some of the things you're talking about. So kind of speak to that. The other thing as you go on to mental health services is we've got a unique partnership with our mental health and recovery board. So a lot of costs related to mental health and even prevention, keeping our fingers crossed, a lot of those things are covered for our districts from other funding.
Okay. So I am going to go into a little more detail on some of the other topics that can be covered using the student wellness and success funds. I'm going to skip ahead a little bit and go over some of the stuff to address Patty's questions that really comes later in the presentation. But so schools started receiving funding for student wellness and success back in fiscal year 20. And there have actually been a lot of schools across the state that were kind of holding on to that money because they weren't sure how long it was going to last, and they kind of wanted to stretch their funds out. Well, in October this year, the General Assembly made some changes to the student wellness and success funds, and schools have been keeping their funds kind of separately. So the stuff they got in 2020, 2019, 2020, 2021, they were keeping all of that in one fund, and then the stuff they got later, they kind of melded it with their disadvantaged people impact aid funds. But student wellness and success funds now have a timeline, they have a deadline. So any funds that schools are holding on to that they received prior to and including fiscal year 24, this current fiscal year, all has to be used by June 30th, 2025, or repaid back to the department. So, it behooves you to have
Christina, you cut out for me. Did that happen to everybody else?
Yeah, I was just going to check that. I am not able to hear her either.
One sec. I'm going to message Christina. All right, 1 second, everyone. Thank you for your patience and understanding.
I know. Can you guys hear me now? Okay. I don't know why, but my mic cuts in and out. So just let me know, Ashley, wave at me or whatever if I cut out again. And then moving forward, any funds that schools receive for fiscal year 20. Let's try this. How about now?
Yes. So we originally lost you when you were talking about the cutoff date.
All right. So fiscal year 25, well, June 30th, 2025. any funding that schools have that they received prior to that. So fiscal year 20, 21, 22, 23, and 24 all have to be expended by June 30th of 2025. And then moving forward, schools will have one additional year to use their funds. So if you earn it in fiscal year 25, you have till the end of fiscal year 26 to use it. If you earn it in fiscal year 26, you have until the end of fiscal year 27 to use it. So they'll have, so that schools aren't holding on to money and keeping it as for a fail safe. And an additional change that they added into this is that 50% of the funds that they get from student wellness and success are now going to be required to be used for mental health services or physical health care services. That's a new change that went effective for the fiscal year 24 set of funding and moving forward. That is to help assure that schools are using the funds to help improve that physical and mental health of their students. Now, the Disadvantaged People Impact Aid Fund is a little bit different. They still have all of those different 17 uses of those funds, but 50% of what a school receives for student wellness and success will need to be used on either physical health or mental health services. Okay, Ashley, if you want to head back.
Yes.
Patty, did that answer the questions that you had?
Yes, and I'm actually doing an email to our boss just to make sure our superintendents, just to see if they need any guidance. So
the superintendents are going to end up getting sent some emails letting them know more information. But that change went into effect in the law back when the legislature signed it back in October.
Okay, thank you.
You're welcome. It is going to affect quite a few schools, I believe, because schools originally had 11 uses of the funding, which included like trauma-informed care and cultural diversity training and things like that. But the uses change every 2 years. But the 8 core uses that we listed for you guys and that we're reviewing today have been in it this entire time and continue to be there. So mental health services, schools can use this a variety of different ways. This could be to hire additional social workers in the schools, school counselors, could be to partner with a community agency to help pay for agency staff to provide that one-on-one counseling or group counseling that students may need that are experiencing some mental health issues. The picture here on the screen is actually one of our new school-based health centers at Toledo City Schools. When they built their new school-based health center, one of the exam rooms was actually turned into a mental health consultation room and it's kind of serves as an office and a room for them to do their mental health services. In addition to those things, you could also use this for telehealth, mental health via telehealth. Some of your districts, maybe, I know districts, I saw somebody was on here today from Marlington. I know districts like Marlington, your buildings are way spread out. You maybe have a mental health counselor that's located at the high school who needs to actually have a conversation with a kid who's at Lexington Elementary. And they could do it via telehealth. And the money could be used to help purchase the telehealth equipment, set up the room, things like that. I'm going to go ahead and switch to the next one.
And just to give context about how this can help students experiencing homelessness, the National Child Traumatic Stress Network reports that students experiencing homelessness have 3 times the rate of emotional and behavioral problems compared to their housed peers. Half, so 50% of students experiencing homelessness experience anxiety, depression, or withdrawal compared to just 18% of their housed peers. And by the time a homeless child is 8 years old, 1 in 3 has a mental disorder. And so as we talk about how mental health services support all students, it also benefits students experiencing homelessness as well.
Okay, so physical healthcare services is the same thing. We do have quite a few schools that have used their student wellness and success funds to actually set up school-based health centers. They've used their funding to actually do the capital costs to set up the center, build out the center, and maybe what was an old wood shop in a high school, or maybe an empty classroom that they turned into an exam room. School-based health centers are all different. Everyone's a different shape, a different size. They can go anywhere from providing physical health care services 1 day a week in one exam room to full centers that are full healthcare facilities with vision equipment and dental equipment. And they do tend to be vastly different. But in addition to that, the physical healthcare services, it could be used to help hire more school nurses for your district. Maybe you only have one full-time nurse for the district. These funds could be used to expand that so that you have a nurse in every building, or a nurse who only has to go to 2 buildings instead of 5.
And as we, oh, sorry.
Go ahead.
As we think about what physical health services could look like for students experiencing homelessness, again, the National Child Traumatic Stress Network reports that students experiencing homelessness are sick at twice the rate of other children, have twice as many ear infections, have 4 times the rate of asthma, 5 times more diarrhea and stomach problems. Additionally, students experiencing homelessness are more likely to be hungry and have nutritional deficits, which have other comorbidities linked to it.
So culturally appropriate prevention services. This is pretty much what it sounds like. This is what schools can use to help purchase implementing those approved evidence-based suicide prevention curriculum, or trauma-informed care type prevention programming. This can be used to help identify students that are at increased risk for substance use, and providing those students with the additional supports that might be necessary.
And relating to what Christina was just saying, the Mental Health and Addiction Intervention for Youth Experiencing Homelessness reports that suicide and drug overdoses were the leading cause of death for students experiencing homelessness in 2018. Additionally, other homeless education liaisons have reported anecdotally an uptick in unaccompanied homeless youth. So students who lack fixed, regular, and adequate nighttime residence, who are not in the physical custody of a parent or legal guardian. They've been seeing an uptick in students making the best decisions that they can and leaving home because their parents have substance abuse issues. And so this is a really pressing issue, which is how the Student Wellness and Success Funds can help support schools and districts offer these supports and services.
Hey, Patty. I have a quick question. Is it time? Can I ask that?
Sure.
I'm just trying to understand, like, the money that's available. I know Patty said before, like, a lot of districts use it in different ways, but is it possible that all the money has to be used for transportation just to and from school, and all these other awesome services we can't even touch because we run out of money just for providing basic transportation? Because I feel like that's the reality.
It's drastically different what each district does across the state of Ohio. I will tell you that. So what has been a requirement of this project or this funding was that schools were required to pull a group together. It was required to include community partners. There were 8 allowable community partners they were supposed to pull in from. Maybe it was your Patty mentioned you guys have a great relationship with Stark County Mental Health and Addiction Services. So probably somebody from there was on it. Somebody from your school is on it. It can include somebody from a pediatric hospital, or maybe even Altman or Mercy. But there are 8 allowable community partners. And as a team, that group was supposed to come up with a plan for your district, how they were going to utilize these funds. Then out of that, then if they revise their plan or change their plan, they're asked to update their plan. Another new portion of the law that went into effect in fiscal year 24 was that districts are required to plan for that with kind of a modified group of, let me find my sheet here. Oh, I disconnected my mouse so that you all could actually hear me. Okay, so the biggest change used to be that they had to partner with one of these 8 groups of people. Now they have to partner with at least 2. One partner has to be either your community mental health prevention and treatment provider or your local Adams board. And then you have to have a second community partner. Previously, you had to have 1 community partner out of this list of 8. Now you have to have 2 for student wellness and success. One of them has to be a mental health provider. So either a community mental health provider or someone from your Adams board, and then an additional partner. So your additional partner could be Jobs and Family Services. It could be your local health department. It could be your local hospital, or it could be that you're partnering with a community mental health partner and your Adams board. So it can be 2 mental health providers, but you have to partner with at least 2 and develop a plan. The plan has to be reviewed by your school board and has to be posted on your district's website. So the new law makes some changes. Patty, I would recommend that you actually take a glance at it with those changes, because there are some changes that were not there previously. It wasn't required to be posted on a website before. It wasn't required to necessarily be shown to your school board, but those are now parts of the requirements. And then I did see there was a question there a few minutes ago, maybe about how did they find out what the amount of funding the districts are getting. Department of Education and Workforce does have payment reports on the website that split out all the different fundings that schools get for different things. So it could be visualized there. But just keep in mind that most of your districts have spent that time planning. You just might not have been part of the planning process. So I would recommend that you find out from your building administrator, what your plan is. How are we utilizing our student wellness and success funds? Because most of them, did do that initial planning and have it set out what their plan is to use the funds. But we do have quite a few districts in the state that still have a considerable amount of money left. If you go to, somebody asked what the law is. If you go to, I keep trying to use my mouse.
It looks like Ashley put it in the chat.
Okay, perfect. Thank you, Ashley.
So it's safe to say that most districts who already have this money already have a plan. So this is a reminder to check out what that plan is and to let your administrators know that the plan needs to be revised if they didn't know about this deadline, to make sure that they're spending all the funds they've received from 2020 up until the end of 2024, correct? Or 2025.
Through the end of 2024, through this school year,
need to be spent by the end
by June 30th of 25.
And then this is also an FYI for your future planning. So
Yes.
if you are going to be, if your school is going to be utilizing, which one of my questions is everyone allocated these funds, or you have to apply specifically for them?
No, all public schools, you guys are pretty much all public schools on this, right?
Mhm.
All public schools are allocated these funds. It's based, the amount of fundings districts get is based off of the per pupil
Mhm.
funding ratio. So all public schools and community schools receive the funding. Last year, I think we had about 988 schools and districts across the state that received the funds.
Yeah. So keep that in mind, that every school has these funds allocated, and find out who is part of that planning process and advocate for your homeless students to be able to utilize those funds. And now that that guideline is in place for the 50% having to be used for physical and mental health, the whole budget can't be eaten up by transportation. Some of it is going to go towards those other things.
Okay, so child welfare involved youth. So programming for child welfare involved youth, mentorship programs that are unique to the needs of children with child welfare that are part of the child welfare system, outreach materials you may need to do, salary or stipends for a dedicated foster care education liaison is always a possibility for some of the larger districts.
And it's important to highlight, and a question that I receive a lot is, are foster youth considered homeless? No, not since 2015 with the Every Student Succeeds Act. However, sometimes foster youth may experience homelessness, especially if they run away from their placement and start couch surfing with friends, for example. Of course, it is a responsibility of the homeless education liaison to make that final determination. So I just want to empower you all to make that decision, but that is something to keep in mind. Additionally, Stark County has 31.3% of students experiencing homelessness in high school. And what that could say is, we know a lot of times unaccompanied homeless youth, so youth who are experiencing homelessness and not in the physical custody of a parent or legal guardian. Unaccompanied homeless youth can be of any age, but they're more likely to be our older students or high schoolers. And so that is just also something to be aware of when thinking about supports and services to offer.
So community liaisons, the types of positions that some of you guys are holding could definitely be paid for through this. Some of the schools that have community resource centers, they can use the funding for their resource coordinator. The costs that might be associated with connecting with the Ohio School-Based Center for Excellence in for prevention and early intervention, or the plan development and any plans that go along with the plan development for a behavioral health or wellness coordinator can be utilized with these funds as well.
And you all know that there is a stigma for disclosing a homeless status. A national survey, national report, Hidden in Plain Sight, found that 67% of students experiencing homelessness were reluctant to disclose their housing status to school staff. We also know that families are reluctant to disclose, especially in rural areas. I've had a lot of rural districts tell me that they're doing the work, they're connecting with community partners, they're trying to build these relationships, but that stigma can be very difficult to overcome. And so community liaisons and that programming can help to build trust to help with accurate identification.
And family engagement activities. This can be really a big thing for a lot of schools for the use of funds. So utilizing the funds for that resource partnership with Ohio State Family Engagement Center, hosting parent education nights, hiring parent ambassadors or parent mentors to provide additional support to families. And communication applications that help to support that timely, regular communication between the schools and the families. Those funds can be used to pay for that as well.
And we know that families experiencing homelessness also want to advocate for their children. Oftentimes, they may not know about their rights. And so these family engagement events and activities are really important to empower families so that they can be those partners in education as well.
And then the before and after school programming, which obviously can be very beneficial for some of the kids that you guys are working with. So these can be before and after school programming that can provide high dose tutoring that aligns with the science of reading before and after school. Maybe, development of any surveys to assess the student and families' needs for before and after school activities, or partnering with local agencies to actually provide the programming if there's costs associated with that. Those can be related to this funding.
And what's important to highlight, again, pulling back to Stark County, is that class of 2022's graduation rate for Stark County overall was 89.8% for all students, which is excellent. But for students experiencing homelessness, it was 66.9%. So as Christina was saying, this before and after school programming can help make up for that gap. Additionally, just something else to be aware of is that the National Child Traumatic Stress Network, which I will be posting in the chat once I am able to focus a little bit more on that. But this report says that students experiencing homelessness were twice as likely to repeat a grade compared to that of their housed peers. And Christina, do you have anything else you want to talk about for the updates? I know we've been, okay.
I think we kind of went over that one already.
So, Christina, Stark County ESC, Christina Winland asked that we talk a little bit about American Rescue Plan homeless funds. These funds are going away. So for ARP Homeless Round 2, which was the formulaic grant, that obligation deadline is September 30th of 2024. For ARP Homeless Targeted Support, which was the competitive $16,500 grant, that obligation deadline is June 30th, 2024. If grantees want to use either of these funds, if grantees want to use either of these funds to purchase hygiene products or school supplies, you can, as long as you do it before the liquidation deadline, and then you can distribute those supplies to students up until January 30th of 2025. So there are still supports for students. If you know, for example, that students in your specific district need 5 winter coats each year, you can, if it aligns with local policies and procedures, purchase those coats before the liquidation deadline and then distribute them until January 30th of 2025. Other funding sources include the FY 25 through 27 McKinney-Vento subgrant competition. All community schools and traditional public school districts are eligible to apply. There are 16 allowable uses, including transportation to and from school and school-related activities, tutoring and family engagement. And as we were talking about before, this is a new round of competition. So this is a really good opportunity to get in there at the ground level and to support with planning, as long as it aligns with local policies and procedures. Applications open on March 4th. They will close on March 29th. More information, including the intent to apply survey, recordings to bidders conferences, the request for application, and estimations of allocations are all available on our website. I know that we've been answering questions throughout, but are there any questions? I'm going to advance to the next slide simply to put our emails up. So if you need an email, you can also feel free to do that.
Could you share that that web page that was on that final slide about the application in the chat so I can add it to our agenda?
Absolutely.
Thank you.
I think I did, if I'm accurate.
Oh, okay.
But I would want Ashley and Christina or Christina Maida. Yeah, got it.
So a question that's come up a lot as far as the homeless designation that I get a lot of calls about is how we're defining fixed. Like, is there a time frame that is attached to fixed? Is there, like, how do you make that determination?
Mm-hmm. So there is not a time limit for experiencing homelessness. This is a question that is brought up a lot, but there is no time limit. Oftentimes, there may be delays in getting Section 8. There may be delays in getting into a shelter. And so there is not a time limit for experiencing homelessness. If a student obtains permanent housing during the school year, then they continue to receive McKinney-Vento supports and services until the end of that school year. But students can experience homelessness for multiple school years, and they often do. Regarding the definition of fixed, the law does not define fixed, which I know is not very helpful. I know it's, very bureaucratic mumbo jumbo to say that. But what I am going to do is I'm going to post a FAQ from the National Association for the Education of Homeless Children and Youth, NACY. They have an FAQ that has so many answers. It is a wealth of knowledge. And although the McKinney-Vento Act does not define fixed, they do talk about the Merriam-Webster Dictionary's definition of fixed.
Thank you.
I see a question in the chat. Can wellness success funds or McKinney-Vento funds be used for summer programs like camps, youth activities, YMCA, etc.?
So for the student wellness and success funds, student wellness and success can pay for before and after school care. The disadvantaged people impact aid funding is a little bit different. That covers up to 17 different things, and that can be used for the extended school year services. So it kind of depends. It's kind of a tricky question. It would kind of depend on the activity, when the activity was occurring. If the camp was occurring, as part of summer school program, then that would be a little different and would probably be an option for the extended school year portion of disadvantaged people impact aid, but it wouldn't fall under student wellness and success.
As far as McKinney-Vento goes, there are 16 allowable uses of the McKinney-Vento Act. Allowable use number 8, and I posted the link to the document I'm referencing in the chat just to have complete transparency. But allowable use 8 is the provision for homeless children and youth before and after school, mentoring and summer programs in which a teacher or other qualified individual provides tutoring, homework assistance, or supervision of educational opportunities. My suggestion or guidance, I don't know, is to reference the use of funds tip sheet. This was put together by a contractor of the U.S. Department of Education specifically to produce these resources. And so it has 6 decision points. And what we've been telling people is to keep documentation of those 6 decision points so that if there is an audit or if the federal government reaches out and says, hey, can you explain how this is allowable? You can say, yes, it's allowable because of these decision points, and we've kept documentation of all of that.
And I will revert back for the student wellness and success funds. It's important to remember that the funds have to be used for what was included in your district's plan. So that team of people that decides what they're going to spend your money on, if they read those allowable uses, those 8 allowable uses of the funding, and feel that it fits in those 8 allowable uses, they put that in their plan, and then that is what makes it approved. So it would have to be in your plan to be considered an approved source of funding. That makes sense.
Are there any other questions? This has been so much great information. I've tried to keep track of all the links that you've shared and put them in our agenda for future reference. If anyone wants to reference those in the future, they are on our agenda, unless I missed any. And I'm going to make sure there's no more questions. Thank you so much for your time. This has been very, very helpful. We really appreciate it.
Thank you so much for having us. And if you have any questions, our emails were there. If not, Christina has our emails, but thank you everyone for your questions. I really appreciate it.
Thank you. All right, and there's just a couple more things on our agenda for today. I'm gonna share my screen again. And I'll check back and make sure we've got all those links for you all. So I just wanted to say like a big thank you to everyone for completing that homeless data survey that I sent out the week of the point in time count. We got 100% response, so we were able to collect the actual data for how many students are experiencing homelessness right now. And I just wanted to share like a summary of those results. So this top box here under ESC districts, so that would include districts that are not necessarily in Stark County. There were 148 students experiencing homelessness who are unaccompanied, so they're not living with their families. And you can see the majority of those are doubled up. And then students who are experiencing homelessness with their families or guardians, the total was 520 students. And again, the majority doubled up, but those are significant numbers that are unsheltered or in temporary shelters as well. But as we've talked about many times, the summary here at the bottom, so the total number of students designated as homeless during that the week of the point in time count was 668. In Stark County, that would be 628 students. But only 157 of those students would be considered homeless under HUD's guidelines. So there is a big gap that is created by those varying laws. And I just wanted you guys to get to see that and see who we're missing, because a lot of these students who are doubled up right now are on their way to being unsheltered. And so keep that in mind when we're talking about what we're going to talk about next, which is like advocacy for some change. How do we prevent these students from becoming completely unsheltered? How do we get services to students who are doubled up so that they have more housing stability? Because either way, as Ashley and Christina shared, it's having a significant impact on their education and their well-being. So I've got other homeless data that's linked here from Ohio. And we've already talked a lot about data today, but just so you have an idea to compare how this is going. I know that in that slide, we saw like a decrease that Ashley shared in the number of students being served. So our numbers right now are under that, but by the end of the school year, they may not. And also the housing data that we have in the whole state shows us that homelessness and housing instability is increasing significantly. So I linked this data here so you could take a look and see like Ohio's unhoused population has grown 7%. So that also tells us that we might not be identifying all of the students who are currently experiencing homelessness, because homelessness is increasing and housing instability and just financial hardship has increased significantly. So take a look at that data. It's very interesting. Sorry, when I added links, my format got messed up here. So go back to our agenda. So highlights from that are that homelessness has increased 7% in Ohio and 12% nationally. Again, this is according to HUD's definition, not McKinney-Vento definition. And that right now wage increases don't match housing or rent increases. From 2021 to 2023, the increase was 18%. And this is something to keep an eye on, because maybe students aren't experiencing homelessness, but they are experiencing housing instability, because over time, if you're paying 20% more for rent and your wages are not increasing proportionately, that housing is becoming more and more unstable. Like we talked about, one emergency away from unstable housing. And in Ohio, unsheltered homelessness increased by 30% since 2020, and chronic homelessness increased 64%, which is a significant increase. So our students who are experiencing homelessness, they're kind of stuck in that cycle. So we want to be like considering ways that our interventions can be putting an end to this cycle. How do we best leverage the funds that we have to make change long-term so that students aren't chronically homeless? And with all of that data in mind, I've included a lot of resources about advocacy and what you can do to like create change and advocate for students at a larger scale. So this first tab here is talking about what affordable housing is and that gap. The second tab here is talking specifically about housing affordability in Ohio. This is a really great graphic. It gives you an idea of what we're talking about here and how easily housing becomes unstable for your families. And then, sorry, I'm switching back and forth between all of these. There is also a map here that's a great tool, and it's broken up by district where you can get more information so that if you do want to write to your legislature to advocate for changes for the McKinney-Vento to be a funded mandate versus an unfunded mandate, to make sure that those resources are available for our students and families. The next tab will take you to an easy way to do this. So Ohio has made it, oh, it switched my tab. I'm sorry. I'll repost that link, but they have created a tool for you to be able to very quickly email your legislator and advocate for change to those laws to make sure that that gap that we saw there between who's being served by the point in time count and who's being missed, and to make sure that we have those resources to serve our students who are designated as homeless. So I will make sure that link is changed there. And then last couple of things, our final homeless learning community this year will be on May 1st, and I will have dates for next year by then. And take a second to fill out the attendance and evaluation survey, and we'll get you a certificate for CEUs. And you can let me know if there are specific topics you would like us to cover next time. Does anyone have any questions before we end?
Christine, I don't have a question, but I have a comment. When you just shared those resources and advocacy tools, what came to mind for me, and some of this is happening, I know, in some of our school communities in partnership with family support specialists and community partners, but it's also good information to share with those community partners in each of your communities, your school communities, so that they're aware of what's happening and the impact it's having on student success, student attendance, or even on their community, because it's still not well known, especially in some of our suburb communities and different areas. It's not well known that there is a housing problem, affordable housing, or a homeless problem if it's not impacting them.
Mm-hmm.
But there's so many church communities and key community partners and mayors and others that could be part of a solution with us in the schools. So it's just how to bring them into the information too and into the solution.
Absolutely. Well, thank you all for being here today. And I'm available anytime, call or email if you have questions or need support in any way. We appreciate your time.